Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Weight loss isn't just about exercise and willpower anymore. Everyday Americans are requesting medications that target hunger, hormones, and metabolism. But are these drugs safe? Today, we have Dr. Madeline Camejo, Chief Pharmacy Officer at Baptist Health, and Dr. Elaina Rosario, Ambulatory Care Pharmacy Services Manager at Baptist Health. They're here to share their expert advice as well as answer your questions on this episode of Ask the Doc, No Appointment Needed. Hi, I'm Miranda Kahn, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. And let's kick things off with a question from Saffron, who reached out to us through our website, allhealthtv.com. Saffron's question is, hi, Dr. Camejo. I put on a couple of pounds the last few years, and I keep seeing these ads on social media about GLP-1 this and Ozempic that. Can you give me the skinny, pun intended, on all these weight loss medications? Hi, Saffron. Love the pun. So, Dr. Camejo, can you help Saffron out with this?
Sure can. Thanks for reaching out to us, Saffron. So GLP-1 medications are the type of medicine that help some people lose weight. And normally it's GLP-1 is already in our body and we actually make it, but its job is to help us feel full after we eat and to keep our blood sugars very steady. Now, these medications, what happens is they act like a extra boosted GLP-1, so people feel fuller and faster and aren't always as hungry. Ozempic is the one brand name you might see. It's the first one that was made to help people with diabetes. But what doctors started to notice is that it also helped many people lose weight. And now there are other versions that made especially for weight loss. And these medications can work well for some people, but they're not all magic. People still need healthy habits like eating good food, moving their bodies, and doing exercise. And just like any medications, they can also have side effects like stomach nausea and aches. So doctors must decide if this is right for you. So in the short version, GLP-1 medications do help people feel less hungry, which helps them lose weight. But they aren't for everyone, and they need to be used safely with a doctor's help. Think of them as a helpful tool and not a quick fix.
Love that. All right. Heads up, docs. We've got a YouTube question from Mateo. Mateo asks, Dr. Camejo, I'm a big guy and definitely overweight, but how do I know if I'm considered obese? And do I need to be obese to get on these weight loss meds? Doctors, I have read estimations that as many as 40, if not 70% of the U.S. population is considered obese. So how do you determine whether or not someone is actually obese?
So that's a great question, Miranda, and thank you for reaching out, Mateo. But there is a clinical formula used to determine obesity. And I will have Dr. Rosario, who consults patients on weight loss medication, explain it further.
Thanks for the question. So doctors use something called BMI, which stands for Body Mass Index. Think of a BMI as a simple tool that compares your height and weight to see if you might be carrying more pounds than is healthy. So here's how doctors usually sort it out. Healthy weight is a BMI of 18.5 to 24.9. Overweight is a BMI of 25 to 29.9. And obese is a BMI of 30 or higher. It's not a perfect system, though. BMI doesn't know if your weight is muscle, bone, or fat, but it gives doctors a quick starting point. Now, do you have to be obese to get weight loss medications like GLP-1s? Not always. If your BMI is 30 or higher, many of these medications are an option. But even if your BMI is 27 or higher and you have a health issue linked to weight, like high blood pressure, diabetes, sleep apnea, fatty liver, or high cholesterol, you can also qualify. So you don't need to be super obese or anything like that. Doctors look at the whole health picture, not just one number. And remember, these medications aren't magic, but they can help people feel less hungry and lose weight safely. when used with the doctor's guidance. So bottom line, if you're wondering whether you qualify, the best first step is talking to your doctor so they can check your numbers and see what makes sense for your body and your health.
Thank you so much, Dr. Rosario. And I'm glad that you explained BMI because I don't think everyone understands it. So thank you for breaking that down. All right. The next question is from our Facebook page. It's from Luna, who posted, Hola, Dr. Camejo. I have a question about these new wonder drugs. Just how safe are they? And are there any side effects that we should know about? And I assume Luna is referring to obviously GLP-1s. I'm curious about this too, doctors. You kind of went into it a little bit, Dr. Camejo, but can you expand upon this further?
So yes, many people do well on these medications and see the benefits like weight loss, better blood sugar control, and lower heart risk numbers. But safe doesn't mean zero risk. It means that for many people, the benefits usually are bigger than the problems when they're being supervised by a physician. So these are the ones that people get most often, especially when they first start on the medication or when the dose gets titrated up. So nausea is probably the biggest one. You just feel nauseous. You want to feel like throwing up. Vomiting could be a problem. Diarrhea, constipation, stomach, abdominal pain. They are usually the most common side effects, and they usually get better after you're on the medication for a few weeks. But they also don't happen as often with other problems that may show up. You need to think about gallbladders, problems like gallstones they can create after a longer period of time use, and even pancreatitis. So if you have any of those kind of issues, you definitely need to make sure you are trying these medications with a physician, and they can take a look at your health and help you decide if you're having severe side effects, if they're a right fit for you.
Up next is another question from our allhealthtv.com page. This time it's from Phoebe. Phoebe asks, Hi, Dr. Camejo and Dr. Rosario. I'm not a big fan of needles, never have been, never will be. So does that automatically mean that I'm not a candidate for these GLP-1s? I think I know the answer to this question, doctors, but I'm sure that Phoebe would rather hear it from you guys.
Hi, Phoebe. I love that our viewers are reaching out with their questions and being so proactive. So Ozempic and most tirzepatide products like Mounjaro and Zepbound do come as injections. They use a tiny pen-style needle that just goes under your skin, kind of like a quick pinch. But yes, they still involve a needle. Not all GLP-1 medications require needles anymore. There is now a new oral pill version of semaglutide called the Wegovy pill, kind of the same medication that's in Ozempic for people who don't want injections, and doctors can decide if that option works for you. So being afraid of needles does not automatically disqualify you. There are other options, and your doctor can help you pick the one that best fits you.
Just a quick little follow-up to that. Are the ones that you have to inject versus a pill form, are one more effective than the other?
So the one that's oral pill form is the Wegovy pill, and the Wegovy is the semaglutide. It comes in injection and pill form. They both are very similar in terms of how much body weight reduction you can see, so around 15%. So those two are very similar.
All right. Thank you so much. All right. We got another YouTube question. This one comes from Takiko. Takiko asked, Dr. Camejo, I was at a wine tasting club last week, and I heard from one of my friends that one of our former members who had been on the pill and was also taking a GLP-1 ended up getting pregnant. Can it really happen, or is this just some urban legend? Dr. Camejo, I've been hearing about this as well. Is there any truth to it?
Miranda, you couldn't be more right. But, what happens is that some GLP-1 medications like tirzepatide, like Mounjaro, Zepbound, they slow down your stomach, which also slow down how you absorb medications or even food. And so if you swallow the pill, this means the pill may not get absorbed well enough for you to prevent from getting pregnant. So studies have found that tirzepatide causes about a 20% drop in how much of the pill was absorbed. So because of this, doctors are now recommending to use extra protection for while you're on the medication. So not all of them But yes, tirzepatide does reduce the pill absorption. So backup birth control is recommended. Semaglutide and several others, no, they didn't appear to affect the pill in studies. But if you're taking a GLP-1 and you need reliable birth control, so talk to your doctor about switching to something that doesn't rely on stomach absorption, like an IUD, an implant, a patch, or the use of barrier methods. So yes.
All right, good to know. All right, Dr. C, this next Facebook question is from Quentin, and he wants to know, hi, Dr. Camejo, once you get started on a GLP-1, how long do you have to take it? And I got one more question for you. Do you still have to diet and exercise if you're taking these meds? Great questions, Quentin. Okay, Dr. Camejo, back to Quentin's questions or question. How long do you have to take these medicines to get the best result?
So Miranda, that is really a good one. But I'm going to let Dr. Rosario, who actually sees a lot of these patients in clinic, give you that answer.
So short answer, most people take it long term. GLP-1 medications like Ozempic or tirzepatide treat chronic conditions such as obesity, heart disease, liver disease, sleep apnea, and diabetes, which means that they work only while you're taking them. So studies show that when people stop GLP-1 medications, they usually regain a lot of the weight they lost, sometimes more than half their weight within a year. So stopping often causes blood sugar and appetite to go back to where they were before. And because of this, experts say many people need long-term or even multi-year use of these medications just to help, especially if they're helping and they have no side effects. So think of GLP-1 medications like glasses for vision or blood pressure meds. They work great, but only while you use them. And now for the second question. Yes, absolutely. These medications make things easier, but it doesn't replace healthy habits. And here's why. GLP-1 medications help you feel full, but diet and exercise will protect your muscles and help keep weight off long term. So without exercise or good nutrition, people can lose too much muscle, not just fat. Up to 40% of the weight loss can be muscle if you don't stay active. So people who exercise are more likely to keep the weight off after stopping these medications. And just as a summary, doctors recommend at least 150 minutes of activity a week, plus some strength training to keep muscles strong. So experts say GLP-1s are like noise canceling headphones for cravings, but you still must choose the right foods and move your body.
Yeah, I'm so glad that he asked that question because 40%, that's a lot. So glad that you're reminding everybody they still need to exercise. All right, Dr. Camejo, we've got another question from the tube. It's from Logan, who asks, hi, doctors. I know the GLP-1s are all the rage these days, but are there any other weight loss meds that are still on the market? And maybe a tad less expensive. My insurance won't cover the cost of GLP-1s. Hi, Logan. This is such a great question. And doctors, I really want to know what other weight loss meds are still on the market now.
Well, a lot of insurance don't cover the GLP-1s, especially, any of the Ozempic, Wegovy for weight loss. So there are several other weight loss medications that still have FDA approval and are effective and usually cheaper. Fertitamine is very inexpensive. What it does, it helps lowers your appetite. And how it works is many people lose about 5 to 10% of their weight in about 3 to 6 months. And things to know is it is this good. It's a stimulant, so not good for people with heart issues or anxiety. It is approved for short-term use. Another one is Kismia. What that does is a combination of 2 meds to cut hunger and reduce cravings. It works well. People lose about 9 to 10% of their weight in a year. And but things to know that it can cause like tingling or some brain fog, not safe in pregnancy. And then Contrave is another combination product. What also helps is reduce emotional eating and cravings. People lose about 4 to 8% of their weight, and it's often much cheaper than the GLP-1s, but can vary widely. So your doctor can really help you choose the medication that really fits your health budget and goals best.
Okay, this next question is from Astrid, who reached out to us on allhealthtv.com. And if you haven't already, we highly recommend that you check out the website when you get a chance because it is just chock full of great information. All right, back to Astrid's question. Here it is. Dr. Camejo, what are your thoughts on compounded GLP-1s? I just read about them recently, and it sounds like they may be less expensive than the regular ones. Really interesting. Dr. Rosario, let's go to you. What exactly are compounded GLP-1s?
So compounded GLP-1 medications like compounded semaglutide or tirzepatide are not the official FDA-approved versions. They're mixed by special pharmacies called compounding pharmacies when a patient needs something that the regular drug companies don't make. But they are not checked by the FDA for safety, quality, or effectiveness. The FDA did temporarily allow compounding during a nationwide shortage, but those shortages have ended. And now, as of 2026, compounded semaglutide and tirzepatide are no longer allowed for general use. They can only be made in very specific medical situations, but they are still not FDA approved. The manufacturers of Zepbound and Wegovy now offer some self-pay programs that significantly reduce the prices of these medications for patients whose insurances don't cover them. So that's always an option too.
Great to know. All right. This question comes from Kalila, who reached out to us via Instagram. Kalila asks, "Hi, Dr. Camejo. What's the biggest misconception about GLP-1 weight loss medications?" Another great question. Doctors.
Well, I think one of the biggest ones is that GLP-1s work like magic, so no effort needed. And most folks, and I think we've touched about this, believe these meds just make weight disappear instantly or permanently. But experts say that GLP-1s are not the magic bullets, and stop using them usually leads back to gaining your weight. And so it's important to incorporate, and we've been really hammering on this, to include healthy eating habits, including more protein to your diet, exercise, strength training to really prevent loss of muscle. Misconception number 2, I think you can just stop the med once you hit your goal. And studies show that after people stop the GLP-1s, people often regain most of the weight, and most of the cravings begin to come back very quickly. So GLP-1s are amazing tools that can help people lose weight, but it's around 15 to 20% of their body weight, but they're not magic, they're not instant, and they're not permanent unless you really make an effort to change your lifestyle. And they help, but you still have to do the work, and you have to change your lifestyle too.
Anything you want to add to that, Dr. Rosario?
No, I think Dr. Camejo kind of hit all the major things that I see too. I think the number one thing that I always counsel patients on is their protein intake. So when you are on these medications, you're going to feel like, oh, I'm so full, I don't want to eat. You stop eating maybe 3 meals a day. But the most important thing is when you are eating, you're eating protein and you're starting your day off with protein. You have a little bit of protein in every single meal. That is huge. And I think the biggest thing too, a lot of people aren't exercising at all. So getting them to even walk a little bit, 15 minutes a day to start, is really helpful. And the goal is to get some of that strength training in, because strength training is the basis and the foundation of keeping your muscle, as well as increasing your protein intake throughout the day too. So those 2 things are key. And that's what I always counsel patients on every single day.
Yeah, and I just want to reiterate for people that may just be tuning in now, I thought it was really important that you brought up that a lot of the weight loss can actually be muscle, not fat, if you don't exercise and, like you said, increase your protein. All right, this next question comes from Emmanuel, who posted this question on our Facebook page. He writes, "Dr. Camejo, what is Ozempic face?" I think I know what he's referring to, but, I'm curious, Dr. Rosario. I mean, you two are the experts. What is Ozempic face?
Yeah, so I can take this one. So Ozempic face usually happens when you're losing weight very quickly. So a lot of the times when you're on a GLP-1, you're losing weight a little bit quicker than if you were going to lose weight without a medication. And so sometimes your face looks a little sunken in, and like the elastin and the collagen in your face kind of diminishes. So I think the most important thing is working with your provider and hopefully your pharmacist to kind of help titrate that medication slowly, so you don't see such a drastic change in weight, so that you don't experience something like this too. Another big important thing too is, again, increasing protein like we were saying, and then increasing your healthy fats too to help with that collagen promotion too. So
Yeah, and when you say protein, I'm just curious. Some people might not even know how much protein they're supposed to consume per day. I realize it's going to be different for each person, but can you give us a general idea?
So these guidelines actually just changed for this year. So they're looking at either like I always say 0.7 to 1 gram per pound of ideal body weight. So the goal body weight. So not like if you're 200 pounds and you're trying to get to 150, I would use that 150 number. So you want to have, and I always tell my patient, at least 90 to 100 grams of protein per day. So if you're thinking about that, you're having 30 grams of protein for breakfast, for lunch, for dinner, and maybe one of your snacks has a little bit of protein in it too. So at least minimum 100 grams of protein, but then it just depends on the patient, your goals, how much you're weightlifting.
Yeah, but that gives us a good idea.
Mhm.
It really does. So thank you so much for sharing that. All right, we have time for another question. This comes from our website, again, allhealthtv.com. Again, highly recommend that you check it out. Amir posted this question. Doctors, how long does it take for GLP-1s to kick in? Great question, Amir. And I'm sure a lot of folks who are watching this right now would like to know. Dr. Camejo.
So, GLP-1s typically start to kick in within the first few days to weeks of the treatment, with the initial appetite suppression often is felt within 72 hours after you start your medication. But they can vary by person due to factors like dosage, diet, exercise. And while some effects are immediate and noticeable, weight loss usually begins real that you can notice within 1 to 3 months, with the maximum effect usually reaches around 4 to 5 months later. You can really see the person has lost a tremendous amount of weight.
Yeah, but there's a safe amount of weight. You guys were kind of referencing this before, so you don't get that Ozempic face. Safely, how many pounds should you be losing and how quickly? Dr. Rosario, you want to answer that?
Yeah. So usually I level set expectations with patients. So usually 1 to 2 pounds a week is normal. So maybe 40 pounds a month. So it really depends on the patient and depending on what dose they start at. Sometimes if they start at the lowest dose, they're not going to see as many weight, like as many pounds lost. But as you titrate up, some patients see a benefit.
Okay. And I know you talked about some of the food guidelines, but I was just thinking about this when we were talking about protein intake. Is there particular proteins that people should, lean towards when they're on this medication versus some other proteins?
So I love how you use the word lean because we want to gear patients into lean proteins. So like white proteins, chicken, fish are the biggest ones. So we always like to recommend the Mediterranean diet which leans a little bit more to chicken, fish as a good sources of protein. But anything you can have in limited quantities, red meat too.
All right.
And I also wanted to talk about one more thing, especially that people don't understand. When you are started on this medication, you're put on a very low dose. So because these medications, if you're put on a high dose, you would feel horrible. So you have to make sure your body gets adjusted to the medication to help you feel, reduce your cravings and things like that. So as you're beginning your first 4 weeks, your first month, you're on one particular dosage, and then you continue to have that dosage increase, and that's what helps you lose the weight. But then you need to make sure you continue to exercise completely as well as you're eating and changing your diet.
Yeah. And again, going to that point, this is not a magic pill. We only have about 30 seconds left. Final thoughts, Dr. Rosario?
No, I think working with your doctor and your pharmacist to figure out which medication works best for you, and even working with the dietitian for any lifestyle changes too, is going to be important.
Dr. Camejo, final thought?
Same thing. Just make sure you're doing your exercise, and that's really important because you do lose a lot of lean muscle mass while you are on this medication.
All right, doctors, that is all the time we have. Thank you so much for joining us today. And thanks to all of you who submitted your questions. We always love to hear from you. That will do it. I'm Miranda Khan. We'll see you next time on Ask the Doc, No Appointment Needed.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.